The risk of diarrhea and prevention methods after floods and storms. After floods and storms, the environment is often heavily polluted due to flooding and the spread of bacteria and viruses. One of the most common and dangerous diseases is diarrhea. Diarrhea can lead to severe dehydration and even death if not detected and treated in time, especially in children and the elderly. Below is information on the causes. Risks of diarrhea after floods and storms, along with effective prevention methods. 1. The risk of diarrhea after floods and storms. Floods create ideal conditions for the growth of bacteria and viruses that cause diarrhea due to polluted environments and poor sanitation conditions. Floodwater often carries waste, dead animals, and sewage, contaminating water sources and food. A. Bacteria that cause diarrhea. Common bacteria that cause diarrhea after floods include E. coli. This is one of the main causes of diarrhea, especially when food or water is contaminated with feces. Salmonella. This bacteria is often found in undercooked food, causing diarrhea and severe abdominal pain. Vibrio cholerae, cholera-causing bacteria. This bacteria thrives in polluted water and can cause cholera. Example: in a flooded area, if people consume water that hasn't been boiled, the risk of contracting diarrhea caused by E. coli or salmonella is very high. B. Viruses that cause diarrhea. In addition to bacteria, viruses are also common causes of severe diarrhea after floods. Rotavirus. This is the leading cause of diarrhea in children, often transmitted through contaminated water or food. Norovirus. This virus causes severe diarrhea and vomiting, especially in crowded or communal environments. Example: when floodwaters contaminate drinking water sources. Communities, especially young children, may face an outbreak of diarrhea caused by rotavirus. 2. How to prevent diarrhea after floods and storms. Preventing diarrhea after floods requires careful hygiene measures to ensure the safety of water and food sources. A. Ensuring clean water sources. Drinking water is the most vulnerable to contamination after floods, so it's crucial to ensure that water is safe and clean. Use boiled water. Water should be boiled for at least 5 minutes before drinking to kill bacteria and viruses. Use water purification tablets in areas where clean water is scarce. Using purification tablets or water filtration systems is an effective solution. Example: a family living in a flooded area should always boil water before drinking or use water purification tablets to prevent the risk of contracting diarrhea. B. Maintaining personal hygiene. Good personal hygiene is a simple but effective way to prevent diarrhea. Wash hands regularly. Washing hands with soap after using the toilet and before eating helps eliminate bacteria and viruses. Use sanitary toilets. Avoid defecating outdoors or near drinking water sources to prevent bacteria from contaminating the environment. Example: in flood shelters, setting up sanitary toilets and reminding everyone to wash their hands regularly will help prevent the spread of diarrhea. C. Ensuring food safety. Unsafe food is a leading cause of diarrhea during and after floods. Cook food thoroughly. Ensure that food, especially meat, fish, and eggs, is cooked thoroughly before consumption. Proper food storage. Food should be stored carefully, avoiding contact with floodwater or contaminated environments. Example: people should avoid eating raw vegetables or food that has been soaked in floodwater and always cook food thoroughly before consuming it. 3. Treating diarrhea after floods. If diarrhea occurs, proper management and treatment can help prevent severe dehydration and other dangerous complications. A. Rehydration. Diarrhea causes significant loss of water and electrolytes in the body, so rehydration is critical. Drink ORS, oral rehydration solution. ORS helps replace the salts and minerals lost due to diarrhea. Drink clean water. If ORS is not available, boiled water mixed with a small amount of salt and sugar can be used to rehydrate. Example: a child suffering from diarrhea should be given ORS regularly to prevent severe dehydration. B. Seeking medical help. In cases of severe or prolonged diarrhea, medical attention is necessary. Hospitalization. If a patient shows signs of severe dehydration, such as persistent thirst, dry skin, or dizziness, They should be taken to the hospital for IV fluids. Medication is prescribed. Avoid self-medicating with anti-diarrheal drugs without a doctor's supervision, especially in children. Example: an elderly person with prolonged diarrhea should be taken to the hospital for treatment and health monitoring to prevent complications. Conclusion: diarrhea is a major health threat after floods and storms due to polluted environments and poor sanitation. By taking preventive measures such as using clean water, maintaining personal hygiene, and cooking food thoroughly, we can reduce the risk of contracting the disease. If diarrhea occurs, timely rehydration and treatment will help prevent dangerous complications.